p.m. Let's do the roll call. Susan.
Present.
Kim. Be here. Mike. Yes, Zach. Okay, we got our full crew here. Let's do the Pledge of Allegiance. Okay, I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, has everybody had a chance to look at the? Oh, do we have any guests? Nobody online. Not okay. All right. Yeah, let's do the minutes. Anybody had a chance to look at them? Any questions, concerns? We have a motion to accept.
Make motion to accept the minutes.
We have a second.
I second that.
All right. Any further discussion? Susan.
Yes.
Okay.
Yes.
Me, yes. Mike. Zach. Yes. Okay. All right. Take it over. Run the show.
So nothing really to report on the vital records and admin. Continue to do good business here. I think most of you have seen our digital signage. I had mentioned it last month, and I know we had like it was kind of a rush to get in. We had some door issues. I did not unlock the door for everybody, but hopefully tonight there was a little more leisurely walking in. So hopefully you did see the signage pointing you to the room that you already knew where to go, but it told you where to go and that it was 6 o'clock if you needed to be here. But for the past 6 weeks now, we have had that up for our customers and our people coming here. And so it has worked out pretty well for all of our meetings and everything. So that's been really good, and no more paper copies and pedestals. And so that's been very good. I had the opportunity, and I think Lori has not been here for a board meeting, but Corey Brennicky with the State Health Department, she was the director of the Division of Community and Public Health. She retired in June, so I did have the opportunity to go to her retirement party. Tiffany Bear, who many of you know, and worked with her, so it's her boss. So, but she retired after 22 years with the health department, and they had quite a shindig for her, but most of them were all internal Missouri Department of Health and Senior Services people. I think maybe 5 or 6 people from the local health departments were there. So she was happy that there were some people. One of the things I want to mention, and Cindy, you'll need to chime in if you have anything to add, or Taylor. We haven't had a ton of cybersecurity issues, but we have had a few. We haven't had any big losses, no ransomware if anyone has would, but we have had a couple threats, and phishing and spam are becoming more of an issue. And the phishing emails are where things that like they get you to click on stuff, and some of you are on the board of services. I know the board of services have been attacked because we got emails from them they shared, and then our people clicked on. That's how it works, right? Because they share. So one of the things that we are going to be doing is we are going to be investing in a couple products called Spam Titan and Fish Titan, which will reduce some of those emails that we are getting. But there's some security awareness training called Know Before, and what it does is it sends out training to all the staff, but it also sends out like fake spam and phishing. And so if you click on it, it says, "Oh, Tim, you probably shouldn't have clicked on this because this would be exactly what a phishing email would look like. And this is why you would not have done this." And one of my previous employers had it, and it was actually really good. You know, I felt like a heel when I had done it, but I did learn something from it. One of Cheyenne's previous employers also had it. It was pretty educational, and that is something that a lot of our staff did not have that education. And for it's nothing is cheap when you do it for everybody, but if it can save us $100,000 ransomware attack, well worth it. Yes, sir.
Is our data being backed up on a backup server that is isolated
So
daily? Because
it's being backed up multiple ways. So it's being backed up on the cloud, and it's also being backed up.
we're not really vulnerable to ransomware.
Right.
That's the main thing.
I'd say there's still vulnerability with that. Typically with these ransomwares, you don't know about it until weeks later, and it's, you know, been uploaded to your backups.
And a lot of our things, like,
your health safety.
right, so like our whole patient record, it's all on or on Oracle, so it's not really local, but so a lot of our stuff is on the cloud through other people's systems, but we still have them, and like we use Microsoft for all of our, and we use enterprise level, and it is all at the level that should be protected, but then we do have a local server, and you just never.
The patient records are web-based.
Right.
Correct.
Right.
You know,
Minimal. But we are also, like, for our local file server, another thing we're adding is duo multi-factor authentication. I don't say it wrong. This makes fun of me, but right now we don't have to have multi-factor authentication, and that is something that makes us a little vulnerable. So that is something we will be adding. And a lot of these things also are things eventually they're going to add for our cyber insurance that we have to have. So none of these things are going to be a waste, because while we're not required to have them at the moment, eventually they're going to say we want that. It's proactive. Any questions about that before?
So these annual fees, those are pretty reasonable. Is that industry standard?
I looked at them. Dustin did a deep dive on at least the Nova 4, and there's Nova 4 is probably the premier one, and anything that is even close is, there might be some things that are cheaper, but they are cheaper in what you get. So, like, yeah, you can probably pay $500, but you get a lot less. And so, and then the other stuff is just about the industry standard on it.
You did your due diligence.
Yeah.
And when I looked, there was several of them were actually more expensive than this, and this one does seem to be having the one as well.
And these are all competitively.
Yeah.
Special good value pricing. At least it doesn't seem like it to me.
It's cheap now compared to what it would cost if you did get hacked.
Right. Because I whined and come. They gave me. They showed me what but they don't care. It is what, I mean, to a certain extent, it is the pricing. And I'm always looking for a bargain, but I exhausted what I could exhaust. Speaking of the budget, our revenue, we are 50% through the year. We are at $3,227,655 or 77.1% of our revenue. Our expenditures, we are at $1,986,118 or 47.5% of our expenditures. Our money market balance, we are at $1,796,450, which is $373.50 less than last year. As you recall, we do have that $250,000 CD, and during our finance committee, and I apologize to Mr. Zach, he had texted me to send him the link, and I didn't see it till too late, so he didn't hear this. But we have our accrued, it is due to mature, that CD is due to mature in August, I believe on the 22nd.
23rd.
Does it say that on there? Yeah, on the 22nd. I think Susan had actually asked how much interest have we made on it so far. So far, we have made, or at least as of this date, we have made $4,653.42. When it fully matures, we will have made $5,735.62. But we will need that for our expenses for the rest of the year.
Just about the same amount as what it costs to do all that computer stuff. Isn't that weird?
So, you know,
Every year, and it'll get higher.
but it is nice to have that money working for us as opposed to just sitting there and
Andrew, for the record, it's not your fault. I was the one who forgot his computer, so I texted like, like, hey.
So Zach, let him go ahead and take
I
it.
was like,
Taylor likes to blame me for everything, so you know, I'm not. Our lease purchase debt obligation, we are at $2,025,881. And so that is looking good. And this was something interesting, and I don't know if you all had a chance to look at the survey results, but I believe, so we started this last August, and I believe this is the first time since last August we have a clean sweep of all fives. We've had 28 responses, and this is the first time since last August that everyone rated us 5 for how friendly and helpful was the staff. All 28 people rated us 5 stars. How easy was it to use our services? All 28 rated us 5 stars. And how would you rate our service? All 28 people rated us 5 stars. So that was pretty neat to see.
Two things that stood out in the comments was Dolly Parton and then comments about the director.
Yeah,
Seems a little fishy.
yeah, but there was some very negative things about the director.
I think it got hacked.
Yes, the director's daughter thinks she's as funny as the director.
Thought it was a little rude that you did not show up. That is, you're gonna have to up your game.
So she came in to get a TB test, and I believe between her and the staff, they colluded to criticize the
Three
director.
strikes rule.
I'd say this is one.
They
It
thought,
says, I wasn't satisfied. That's the quote right
What
there.
are you gonna do?
I mean, we should finally mention it, sir.
True, so we'll have a remediation plan in place by next month.
they kind of
Attention
felt
is
like
attention.
she should get more personal attention.
Thank you.
But, again, just wonderful feedback. Nice.
Don't worry, Dolly has it covered also.
Dolly.
And
She
that
worked
is
here.
that she used to do like the imagination library, so there's actually cardboard cut out with head back in clinic and people seeing it and taking photos.
Oh, okay.
We try to use it for decorations for some.
All right, so we've been doing health educator interviews this past month, to replace Cheyenne's spot from her previous position. And we've hired a new health educator who will start on Monday, assuming that you all approve that. Lots of business as usual. I'm still working on the fire inspection stuff. But we finished everything that was requested to be done. We're just waiting for the company now to certify that we've done it and take off the deficiencies that they had previously put up there. And they actually came out today just to do one last re-inspection because they forgot to check something the last time they were out. So everything should be good with our fire inspection. Talked to the fire marshal and he's been very helpful and supportive. HVAC, we've still had a few humidity issues and we're still kind of trying to assess the situation because some weeks are better than others. It kind of depends on the humidity outside. So right now we're still kind of collecting data and trying to figure out why it's doing what it's doing because some of it is a little bit sporadic.
And I'd say the main thing is we know we put in the duct heaters and we know the one in this room is not working. All the others seem to be working, but the economizer on RTU1, and that is what lets the outside air back in. The economizer on RTU1 seems to be letting in too much outside. So it actually seems to be a problem with the unit, not any of the dehumidification equipment. But we need to see what's going on. We're doing the tracking, so when we call them back out, we can make sure the things are fixed. So yesterday we had a meeting. We did realize that some of it's maintenance too. Frank identified an issue where when the units are working properly, they pull all the moisture. If the fans don't drain correctly, water sits in the units. So the downspouts were all clogged, so it was holding the water inside the unit, increasing how much humidity comes back inside. We have now added that back to the maintenance schedule. That won't happen anymore.
And when the water gets too high, there's a shut off switch that shuts down.
But these are outside, so they don't actually have that. But they have way too much humidity because the air is flowing over water. So that's actually a big problem. You don't want it over nasty, yucky water. But anyway, we've identified that issue. And so that was surprising.
When are they going to come and check it out, Straub?
Probably in like a couple of weeks when we have better numbers.
There was a few weeks to see track
And we kind of had an issue, I'd say an issue, with we were tracking the high humidity, but I wasn't clear, I guess, to our data collector. She only collected when the humidity was high. And there were several times when it was high. And that's good, but you also need to collect when it's normal, so you can compare. And so when you only take it when it's high, you don't, like, you can't tell what's going on with the weather and stuff. So over the next couple weeks, we will be collecting it at standardized times throughout the good and the bad, so we can tell actually what's going on.
Should be pretty humid the next week or two.
And that's what we're hoping. And we know that, like, when it's, like, some of the times the humidity was high in the building, because it was like 68 degrees outside and it was raining. The humidity was 100% outside. So the air conditioning wasn't running at all. Well, it's going to be humid inside. Because you're not cooling. It's 100% humidity. It's going to be humid. The temperatures were perfect, but it was humid. So, and that was like 2 of the times, and then there were some other times. Clearly, like, I was not aware that all the time she found were actually there. It was like, I told you. But I mean,
Health Ed had a lot of events this month, so Abby and Trisha presented at the Child Care Health Consultation Program Annual Advisory Meeting. They've been doing several dental health promotions where they do varnishes for preschool students. They've done a lot of collaborations with the clinic. I'm sure Dustin will talk a little bit more about that, but we continue to do the Know Your Numbers. It's kind of a blood pressure education program where they teach people about taking their blood pressure. And then we also started the Vax series at the library, talking about vaccinations and different things. Clinic, library. We also had another blood drive. Here's our harvesters numbers. Home-based visiting. See that food safety classes were really high in June for some reason. And then our June spotlight for the environmental health, there was an issue with, essentially there was a scheduled power outage that ended up turning into a longer term power outage than was expected. And that ended up leading to some electrical damage, flooding, and loss of food in 3 different food establishments. Now, the company responsible is going to be, their insurance company is going to be covering all of those costs. But we just, it was really great to see our team kind of like working with them, letting them know which things had to be thrown away. And they were really understanding, and they are going to be reimbursed for some of those things. It was a little bit sad to see all that food thrown away, but you know, gotta keep people safe. And the good thing is it's going to be insurance. So all food has to be under 41 degrees if it's being stored. And so several of these you get 65, 68 standing water. So they were, most of the places I think have been able to reopen and were able to get more food. But I like this month.
and there was a lot of good communication between our staff and facilities, and it was 3 in that very mall. So,
And the they were really understanding, really.
Yeah.
They worked with us.
They have to be given guidance about how to proceed.
Right.
And they know it, and it's not boogeyman or big brother or, you know, the machine that they're up against. It's just they needed guidance, and they're the authoritative guidance.
I think the unfortunate thing was the facilities had nothing to do with the power outage. Like, they were doing everything right. So our staff was very empathetic to their situation.
Sure that
They were able to salvage some things, and I think they helped them set up, was it coolers, like
They brought in reefer trucks to
some.
unload their coolers and put it in, so a lot of their stuff was safe, but some of it was.
Question for you. You have an intern that started in May. How long is he gonna be here for?
Just for 2.5 months.
He's done for, and then we're getting another intern then for the fall?
Plan to, so we're in the pathways program with the state, so basically the state pays for interns, and they pay them. So it's a great program, they match us with an intern. I think we signed up for 2 interns for the fall. It kind of just depends, and then after they pair us with someone, then we do an interview as well, and then determine if they work with them or not. We're not obliged, but then the state pays them, so it's great because then the interns are able to get paid, but we're not having to leave that out of our budget.
And the guy's name is Ethan, right? Is he gonna do like a presentation before he leaves, or how does that work?
Here you might. When it's
Just curious. You don't have to do it. I was just curious.
Yeah, so he's working on several projects, and Andrew keeps hijacking my projects that he's working on and giving him more things. So
Every time.
yesterday I saw him putting together a Blackstone, and that was like, right now.
I want them to have that full experience, but you never know what you're gonna get.
So he's had a wide variety of experiences. He's been doing health promotions with some of our health ed staff. He's shadowed several things. He's done environmental staff to do some inspections. I think he shadowed clinic. No, or he went to shadow us in a clinic. But he's pre-med, and he wants to become a neurosurgeon. So he's very smart, very, very hardworking. So good to have. Yeah, right now he's also collecting data about the leave policy. Just that a few months ago, so he's just waiting to hear back from a couple departments. Before we can contact you.
As Heather said, we were partnering a lot with health education the past month, doing a lot more events, a lot more education, like for our Vax series. We'll highlight one specific vaccine preventable disease, discuss that, the importance of it, as well as we'll also bring the vaccines with us, as well as routine recommended adult vaccines, trying to reach more people. Hope also has some of this information that is out there. And then the Know Your Numbers program is always been about trying to encourage people to actually know their numbers and actually go out and see what their blood pressure actually is. I'm sure you guys all see a lot of people who are younger and younger who are starting to have high blood pressure. Life's definitely never ever stressful at all, so I'm sure everyone's blood pressure is just very and fine. We're trying to target those people who don't really think about it and trying to get that in their heads and their minds that they're knowing blood pressure, how they can manage it, and then to prevent it from ever going too high. We had a quality improvement visit from our Vaccines for Children program. Basically, just go through, look at the data, look at our vaccine rates, and kind of help give us advice and things, kind of what they're seeing in the state, as well as locally, and trying to give us a little better on that. We did a couple people for active cases for TB. We're still working on. We just got another one a couple days ago, so we're definitely busy with that. Dr. Kingsley had a question last month, and following with that about the formula. So essentially, whenever they get their formulas, normally they just go to the pharmacy. If it's carried there, they just pick it up using their vouchers. There are sometimes whenever like Medicaid insurance will send it directly to their homes. If they are uninsured and underinsured, they'll get sent here to the WIC office and will come here for an appointment.
They have to go to the pharmacy to get it, or they can go to Walmart too.
Usually Walmart. The grocery stores, usually pharmacies at the grocery stores will have them too. So it kind of depends on which specific formula they're trying to get.
Yeah,
So,
more pricey, hard to find.
so
Yeah.
They finished issuing all their farmers market benefits. So they had 75 vouchers they're able to give for people at the farmers market, which is actually really nice right now due to little outbreak on across the U.S. So had a pretty decent month. Their numbers were up from last year, almost as high as what ours were back in 2024. Still not great where they're wanting to have them yet. Just go down here. They had a few comments. Overall, pretty positive of what their people's experience are with the Swift Clinic. The one complaint they had, the overall just people at the clinic itself. Reason he just had issues every time he comes here, something gets mixed up in his demographics. Like, and he'll watch the provider actually go in, manually change it, and fix it. But by the time he comes back, it's just some random thing that happens.
When is SWO representative going to come to meetings to kind of give us a state of the union kind of thing?
We're gonna have to come in October. It will be their second year anniversary. So, but yeah, it's pretty much my work report. If anyone has any questions.
Okay, so this month, we're preparing for the accreditation site visit, and we do have our site visit dates now. Our virtual the Wednesday, September 29th in the morning, and then our in-person is going to be Tuesday, October 6th, also starting in the morning.
September 30th.
Yes, I don't know why I keep saying the 29th. It's the 30th. It's Wednesday, the 30th.
Okay.
Is the virtual,
Yes.
and then the in-person one is Tuesday. What?
6th, right?
Yes.
Yeah.
October 6th, right?
Time of day.
It starts in the morning. It could
8:30.
yeah, it could go all day, but also.
Can I butt in real quick? So, Andrew, you and I talked about this. So you want us or don't want?
So on the virtual, we do,
Just on the.
on the.
How many do you want here? You want the whole crew or one or
No, we
two?
need two, up to two board members. And we can't have more than two.
Because it would be a board meeting at that point?
Yes.
Well, why don't we just put it down as a board meeting?
We can't do that.
So they won't allow us to.
It can't be an open meeting. And that's according to that.
You guys want to go? I keep taking everybody's. You guys want to go? Zach, you want to go?
What was the date?
October 6th.
I would be interested.
Yeah, I'm available to go, but I'm not going to steal somebody else. So if you want to go, by all means go. And then we still need one other person.
She hasn't sent us the full schedule, so like, it's basically a full day of events starting at 8:30. So your portion will only be probably an hour. So also if you want to think about it, and we can, once we get the actual agenda, we can let you know what time it will be.
And is there, do you want a position there? Do you want?
It's
doesn't
really just two board members and there'll be a specific time slot for the board portion.
Do you want to go? Do you want to go? You guys?
I would love to attend, but again, if anybody is enthusiastic about being
It's
there.
probably gonna be difficult for me to attend.
Okay. Do you want to go?
I mean, I can be there.
So you two. And then if one of you can't go, let us know and then we'll be replacement. That sound fair?
But we will know more about the time. And we will let you know, and it's not till October.
Yep, so we're good.
So
Well, I've got it at least in here so that as the schedule requests come out.
What kind of questions do you think they're going to ask us? Just curious.
We're trying to find that out, so. Aren't allowed to be in the room for that. Another person who was doing it said that their site visitor did not allow staff to be in the room. So we are still trying to. You all, but I think essentially it's gonna be your questions about the health department. I think we we're looking into it, and once we find out more, we'll also.
You want us to blast her?
They're gonna get a good question from me. What Andrew heard me ask the representative of the Melbourne is, what data do you have that accreditation actually improves outcome?
well,
That's a legit question.
so they will be asking the board questions.
That's all they want.
I'm gonna ask that question. Yeah, I'm serious. They better have data. They better be able to answer that question.
If they get naughty with us, we've got our ace in the hole.
Well, the thing is, like, we don't do all this work and find out it really didn't make any difference.
Well, it's.
Well, I can already tell you, it's made a huge difference.
But they need to tell us that.
They need data.
I don't really care what. I mean, because I can tell you
Right.
from the health department's perspective of the Platte County Health Department that we have made humongous changes over the past looks at everything that we are doing. We are making changes daily. We are, like, it is so much hard work that the staff is doing and looking at how we are doing things and trying to make things better and trying to follow best practices and just the research that we are doing to find best practices throughout the country to make sure we are not the best health department in Missouri, but the best health department in the country.
Amen.
Now, I don't know if we actually will beat that, but that is what we are striving to be.
I think
My people are so tired of me saying, go out and look at all these websites. I want to see the best things. And they're like, Andrew, we can only look at some. I don't care. I want to look at them all.
you have the right answer, but when I think I was there when you asked them that question, they did not give that answer.
No, here's the thing, outcome measures take years, sometimes decades.
Right.
However, are there some data points that can be looked at? I think the question raises the issue of what are the data points? Are there data points? If there are, why aren't we tracing 5 years before and 5 years after accreditation? I think that's important because I'm trying to help lift and encourage all other health departments to do the accreditation. And you got to look at the return on investment. And other board members in counties that don't have big budgets, if we can share with them and find data that says, hey, constituents, you can tell them, when we did this, this is what got better. And I found myself in a situation where I was trying to support accreditation, but I said I'm data driven. Is there any data? There's the data. If there's not, can some be compiled? And can it be done statistically relevantly? So that's where I was going.
And even on the FAB website, if you look at it, a lot of it is qualitative rather than quantitative. And even our own experience, if you improve surveillance, disease surveillance, what you end up doing is you find more disease in the community. So are you doing a better job? Well, the numbers would see you're finding more cases.
Yeah.
So is that actually better?
That's why I said,
what I can tell you is, like, for our policies and for the different things we're doing, or even just like our experiences for our customers, we are doing a better job of the things that we are seeing, like for the policies and things. They are so much more clear. We are identifying where we need to put our resources.
as the director, you are convinced the accreditation process itself has improved the surveillance and all operations of this health department. Because that's enough to sell to some other folks. I've digressed that, so I'll stop there.
Now, and we've had these talks.
Yes, we have. It's one like dead horse.
But I do think it is valid. And, I wish there were some, because you always challenge me with, what are those metrics? What are those things?
Are there?
And I haven't
We were doing surveys before,
exactly
now you're doing surveys.
Things you're doing.
Yes.
I think a lot of it too is just putting in multiple systems in place for continuous quality improvement. And so we've started, like Andrew said, we've redone like our policies, we're making them more accessible, like a lot of different things. We're making it so that there's lots of systems in place that like we're able to keep going.
And the people and staff are meeting routinely, and we're not letting, and Cindy's been around a long time, but I think one of the things that maybe happened in the past is we go gung-ho about something, and then it might last for a year or a year and a half, and then it kind of fizzles. And this is because it's truly CQI. You might like me to forget, but we're not letting these things die. We are continuously, it's time to do this. you know, we have these routine meetings and we're not letting, no one's forgetting continuously doing these things. So,
Even with like succession planning, like doing a lot of that stuff and like having like resources available that we're crafting that like these policies are step by step easy that anyone can follow. So whenever, if like next month all these people are gone, we'll have people come in and be able to know what they're doing and have those kinds of.
Well, and I
Like
know
some of
we-
the policies hadn't been looked at for a few years.
and whether they be board policies or policies for the staff, that's another thing that several times.
Keep rolling, sorry.
But I know you're, I was letting you guys.
My apologies.
letting you guys go.
We're enthusiastic about being the best we can be.
Yes.
Okay.
So we will get an agenda. About 2 weeks. And
I mean, just need to be like,
oh, okay. So everything's going well with that. As for our epidemiology and emergency management, they held down the fort while I was getting married. So keep working on World Cup partners to monitor and daily situation reports. Knocking on wood last month seemed to work. Nothing exciting happened, so we'll keep knocking on wood this month and hope we don't get anything residual in the upcoming weeks. Our emergency response planner worked 2 shifts at the World Cup Nation Center. He said that that was very valuable and insightful.
Everything ends on Sunday.
Yeah.
I heard your team's still in it. This is their home base, right?
Yeah.
Yeah, so.
Okay.
So for another
They
until
left,
Sunday, then
Actually,
They left 2 days ago.
forever.
yes, they're headed to where, New York?
They're going to.
That's what the game is.
Yeah.
They're not even coming.
Practices and photo opportunities, so they're not coming back here.
All right, well, it's over for us.
Yeah. So hopefully nothing residual, but I'm very
Yes.
happy with how. And of course, Taylor's our soccer league.
so one thing on this report, you'll notice in June, we did have one cyclospora case, and Dr. Chape contacted me, was that yesterday? And you probably have seen it in the news. And if you notice from our report, we had one case, and that was our one case that we've had for the year so far. And it was actually at the beginning of June. And I think everyone knows that it's a reportable disease. So we do an investigation on it. And it was actually travel related out of the country. Or it appears that, I keep telling Taylor, don't know 100% that it is, but it appears to be travel related. So I will correct myself and make sure that I say it appears to be travel related. We did get a press inquiry today from, I think, Channel 5. But they were asking us how many cases, but the state of Missouri put out a health advisory yesterday. The state of Missouri has received 80 cases so far for the year. And of course, that's why they were calling.
Are they all on the east side? No, Steelers?
They're kind of throughout this.
The incidence of this, I'm gonna chime in if that's okay. The incidence of this disease process is probably 4 times what, or more than you're seeing, because the testing is difficult, cumbersome. The facilities that have rapid PCR testing to take a stool sample and test it are very few. Currently, LabCorp and Quest Laboratories do not have a rapid PCR test, which means you have to do a microscopy. And that microscopy is only 37 to 90% sensitive.
37 to 12 was it?
37 to 90% sensitive.
So it's not.
There you go. So, and that's $100 test on top of the oven parasite, on top of all the others that they order. But if you order a GI pathogen by PCR and have the add-on of the Cyclospora, it can be anywhere between $200 and $600 for the test. So testing is difficult, but I will tell you, we are treating 6 cases a day in Gladstone right now, because I had to put out a physician protocol guidance for all of our providers. What are they to do? Are they not allowed to treat, or what do they do? So, given the information in the press, I don't think we're going to have a prolonged issue with this. Currently, the CDC, as of today, has, they think, narrowed it down to a supplier of Taco Bell, Taylor Farms. And,
Taco Bell again.
well, the issue, and here's the thing, this cannot be killed with disinfectants. So, and it takes 153 degrees temperature. So the recommendations will be to cook the vegetables, and they pulled the lettuce, and they're going to continue to trace that. But I don't believe that Black County is going to have major adverse outcomes to its residents. But the cases are much more prevalent than we are going to get reported because of those logistics of testing.
When you are looking at just the lab confirmed numbers, and then you have the restriction, the inhibitors to giving the lab confirmed test, which is what Dr. Chavez and I talked about yesterday, and then or going to the doctor and just getting treated. Well, none of those people get counted, of course, and so 4 times as many, maybe 40 times.
I was being conservative,
Right.
by expansion of it. It's I worked 8 to noon in Gladstone on Wednesday, and I had 4 cases.
Right. Because those are the people that were sick enough to come to the doctor. So many people.
Most of it is self-resolving. You just run your course and you move on with your.
Correct, but when you've got a 32-year-old construction worker, 5 days of impressive symptoms, I gave him the choice: we can treat and get a sample, or we can get the sample and wait treatment on it. And the
Treat.
he said treat. And I said, okay. The sample, he goes, nope. So I had to document the chart: patient declined this test. I will do the next best thing for him. So that's where we're headed with this, because there is no human-to-human transmission. Well, there could be, but it
Well,
definitely
yeah, I was gonna say, there's.
very
Yeah.
no hand washing.
Yes.
Limited.
Yes, ma'am. Wash your hands.
Wash the hands.
Back to wash your hands.
But typically it's not human.
So have you been to Taco Bell?
No, I think but go my way home. I can see that. I have bathroom at home. I'm not worried.
That's right.
It's a good diet.
All right, thank you for letting me address it, because I wanted, from a public health standpoint, wanted to share that with the entire board, to give some context to if there were steps we should be taking or surveillance or something. I think it's pretty good where it is now. I think it's going to be self-limited, and since it's not a life-threatening illness, you're immunocompromised, it should be fine.
And as we were talking yesterday, and I just wanted to point out to anyone who's watching or listening, it is a reportable disease. It is something that the health of one of a huge list of reportable diseases that the health department. It's mandatory that it gets reported to the health department. We have people that actually call the people, do a food history, do the interview, just like that one that we got in early June. We do the food histories and we do those things. That's how they find out, like, whether it be whatever. There's people all across the country doing these, but ultimately, sometimes when there's testing challenges or whatever it is, the lab confirmed portion of it does present some challenges. And so, but it was an interesting conversation we had.
Yeah, especially with the highest incidence of cases in Michigan, moving down into Ohio, and then some in the Kentucky, Tennessee area. A good investigator is going to say, okay, why? Why there? And so I think it's a supply issue.
Susan,
Yes,
and you can call on Zach. but
I
think-
will. Finance meeting we had this past Tuesday, and the main topic that we discussed and listened to and back and forth with was the 457B plan for the employees and what they're experiencing now. Security benefit is the benefit that they utilize now and have the option of going into this investment program. It's like a 401k, but it's 457B for health employees. What has changed though, and what Michael Allen was the person presenting, was that now it's a little bit of a structured change in terms that he would have the health department, which he has been the representative, but instead of just all of these things you can invest in, security has a list of it. He would keep kind of be their manager of it and kind of look at the investments a little closer for the employees that choose to be in the program. So like if, let's say something isn't doing well, he might be able to catch that early on and help the employee do something different. If I heard that correct.
Yeah, so right now, security benefit is the plan administrator, and they also oversee the entire plan. And retirement plan advisors, who Michael Allen works for, are kind of like they work for them. They're contracted out by them, and it's basically we pay a 2% admin. Under the proposed plan, retirement plan advisors would take a more active role. They become more of an active, they become more of a plan administrator. Security benefit would take care of all the administrative stuff, but the cost to the employees would be reduced to 1.5%. So it would become cheaper. We would have,
And probably more efficient for them.
and it would be more of the regular like mutual funds, so American Century Ultra and different generic kind of mutual funds. Yes, sir.
What, I'm not familiar with the 457B maximum employer contributions. Do we currently do an employer contribution? Is that something we're going to discuss?
No.
Yeah.
So no plan changes for that. It is all contributions from the employee.
Which is, I'm not commenting about the whether that's good or bad.
We also have loggers, the state pension program that like we can put in there.
So this is like, you know,
In addition.
in
In addition, so for some employees who might be able to put more pre-tax dollars,
yes, if they could start, you know, putting some in early on, trying to encourage them to do that. But he's going to come back and do an in-service for all the employees to kind of explain what's going on so they can have that option. I don't know, at a staff meeting. And the other thing we asked him was, did he have any data that would show what happened just with security benefits versus the RPA's involvement? Did he have any?
Yeah, I think what I asked for under like the current security benefit plan was the yields better under that current plan versus what RPA is doing. I was just curious overall with the packages, because there's basically high, medium, and low risk. You know, there's kind of some fixed packages for people like me who don't want to really choose individual mutual funds. I just want to basically say, this is where I'm at in my life. This is how much risk I'm willing to take on. What's the package? Well, between the two packages, how are they doing as far as performance? And
He didn't know
so
if he was
he's
gonna be
getting-
able to, but he's gonna look at that, yeah.
But then the question I guys have, so can an individual meet with this person or is it have?
No, he meets with individuals, he comes 4 to 5 times a year.
And you
And
can
meets
just
with
schedule time
individuals.
and sit down.
But I think he was gonna just generally.
Right.
Kind of talk to the staff as a whole.
But if somebody had a specific thing they wanted to work on, they could
Yes,
sit and talk.
yes,
That's cool.
and
All
he
right,
does.
The main thing that would happen is we would need board approval to switch from security benefit doing kind of everything, the RPA taking over the, switching, it's kind of switching the 457 plan.
Does that need to be done by?
It would be next month if we,
So you guys will decide if it's a done deal or what happens?
well, we would basically bring back a recommendation.
This time it's just kind of information and see if he can bring that more data back to.
What do the employees think? They're all on board or no?
Well, right now it's just to the finance.
So the
Now,
employees only have-
everyone on the finance committee seemed to think that it
It
would be.
seemed positive.
But I wanted to know what the yields are.
I mean, that should be available data. If they're not tracking that, then.
I mean, on the cost side, it's like pay less or pay more. That seems like a no-brainer.
Yeah.
But if I'm going to make less, then I don't really want to make less money. I'd rather pay a little more and make
Right, so that's the whole point. So.
And
that's-
catching
that's
things early.
Something that you would track. But how did that perform compared to someone?
Now, if they're equal performing and we can pay less service fees, that seems like a no-brainer.
If you stay with the current plan, the employees still can meet with a representative and go over individual stuff.
Yeah, the employees are going to see very little difference. It's the same guy. It's the same,
Everything's the same.
like the same app. It's the same. The only thing that might change is the group number on their statement.
And both plans have, like you were saying, conservative,
Yes.
moderate,
Right.
Low, medium, high risk.
and crazy go nuts.
Yeah, he'll explain the value of compounded interest. For example, if you just started at $100 a month,
And that's what he said.
yeah, compounded interest, the value of it, just $100 a month in 10 years, if you calculate 8%.
And he's got a graph. He
Yeah,
says, that's what I want to show the staff. He brought that up.
And that's important.
That they can see a picture of
So-
what they were.
To give you some concept of how many people we're talking about, currently we have 43 people that have 457s. And it's $2.1 million in assets. So I think that averaged out to like $48,000 or something. But some of those are past employees too. And so I know some of you know a man by name, Dan Luber.
It sounds familiar.
No one knows him.
He has 2 million in his.
But he was so good at trying to get our new employees and our younger people, like he really would get on a soapbox and try to tell them, hey, if you have $50, if you have $60 a month, put this away. You will never miss it. And someday it's going to be $100,000 that you are going to really cherish. Like it's going to be a big amount of money that you are going to be amazed. So he really did a good job, and we have one of Cindy's employees that she comes in, she has lots of expenses, and I'm just so impressed that she sits down. I have no idea how much she donates or not donates, but invests. And it's like, if she can do it, every single person here can do it.
In summary, you're looking to provide counseling services for investments for the employees at a cost of about $48,000 a year.
No,
Is that what this?
no, there's.
Oh, they're paying the 1.5%.
Right, they pay. So there's no cost.
Yeah, and that's fairly standard.
But it is a group plan that we oversee, so the board has to make the decision if we change the structure.
Most plans, a lot of private advisors, if you have enough capital, at least $1 million, they will do it for 1%. Hopefully, so these guys are going to aggregate those 5% of the whole and provide those services if the employees pay. Okay.
Right. And the one big difference with the 457 is that employees, if they terminate service, they can pull their money out without any penalty. And that is probably the biggest. Now, I would encourage employees to roll it over to something, but they can pull it out and just pay the normal taxes on it. But that's up to them. And we will probably be bringing there'll be probably a memo coming next month. Anything else, Susan, or Zach?
I don't think so. That was the main gist.
So finance is done, we did.
Cindy, anything?
Right, so then we have to review and approve the bills.
Yeah, I think that's what Cindy said.
Okay, so does everybody have a chance to look, any questions, concerns?
I make a motion that we pay the bills.
I move that we pay the bills.
She already made the motion. so you're
I
second.
second.
Any further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach? Okay. Moving on. Do a fee resolution, I guess.
Yes.
We added yellow fever. 200. Last month, I think we might have added Japanese itis for $103. About $5. About $3.90.
Are people actually using those things before they go to travel to China or something? Or?
Could be travel vaccines for a lot. So it's like usually, I know we're
Is there a travel clinic? Somebody, isn't there one down at KU or UMKC?
Yeah, there's a couple that are around. Most of them are like on the campus site, so there's not a really good market for it. So like maybe we can try to sneak in there. We just got approval for the yellow fever, so we have a draft website portion of it, draft web page for travel clinics that we are going to go big and trying to get out there.
I love it.
Hey,
That's where I was going to suggest.
yeah.
That's
So
awesome.
we've had numerous discussions about how we're get that.
And given the proximity of the airport and, yeah, okay, never mind. Go on.
We could be
Scroll down
the
to
area
the
kings of this thing. Okay, so take it over. Let's do it.
So then you'll just set up.
And steal all my items.
No, we want to help.
So we'll set up an appointment
Okay,
time.
move on. I move to approve the July 2026 fee resolution.
So second.
Second.
Okay, we do have one quick question before we do that. What was your question?
Will you set up an appointment time for the person then for the vaccine, or how will you do that? I can't imagine you would just keep it on.
So they have like about a 2-year shelf life for most of them. So
Okay.
Japanese syphilis, nice thing about it is we can order as an individual. It comes as an individual
Oh,
dose,
good.
so
Okay.
that makes it a lot easier
Yeah.
for not worrying about wasting. Yellow fever comes in like 5-dose vials, so we do have a little bit of leeway. We're going to keep a small amount on hand at first, just so we kind of see what the demand is. With the clerks that a lot of times that we have like a lot of people coming in for yellow fever or wanting to travel or something, it's usually for like a church group or mission group or something. Already, so making sure they have like, oh, hey, we got about 20 people in our group getting ready to go out and do this. Like, okay, let us call and order a bunch of extra of this.
Be careful with multi-dose files, because if it hasn't been initiated, it can have a 2-year shelf life, but once it's been penetrated, that shelf life may can't.
30 days.
I know, right? I'm just saying it may.
When did they need to have this put on?
They recommend it's a two-dose series. They're gonna have to go before you go. They usually, as long as you get the 2 weeks before your trip. So.
All right, so there's motion, there's a second, we're discussing, let's vote. Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach? Yes. Okay, so next thing is the WIC services contract.
Yes, so each year, this is basically the grant we get for WIC to kind of help fund about 75% of their so our contract increases this year by $34,990. This is just to help support the services and the regular plan. We offset the remaining costs just through health department.
Move to authorize the, oh, you guys okay if I make a motion?
Yes.
Yes.
You ready? Okay. Move to authorize the director to sign the WIC Local Agency Nutrition Services contract with the Missouri Department of Health and Senior Services for the period of October 1st, 2026 through September 30th, 2027.
A second?
I second.
Okay, I do have one quick question. So was this pays 75%, so where's the other 25% come from? The cost come, is that just us?
That's us.
We need it?
So we budget for it each year, try to anticipate that for that, and then use that. The nice thing about this one coming out and like being from October through September is we know how much it is, so it makes it a lot easier for us to budget for our when we start doing our thing in like October, November, getting ready for that. So we help offset.
Which is nice, because it's not like we're not going to offer WIC.
No, I mean, I was just curious.
So, and I guess it kind of depends how you look at it. You said we eat it, so we use local tax money to supplement.
We pay.
But we do, and I think that is one thing. It's funny how you said it, because it's something that I have had a conversation with staff about, with Dustin about, other places I've worked, like the WIC funding is the WIC funding. For many years in Platte County, for the health of, we have utilized local tax money to supplement those. That does not happen every place else. So, I mean, I think sometimes, and I think it's a great use of the money. I'm not saying anything about that, but I do think that people just need to realize that we're supplementing it with a quarter of the budget. And when we're going to have the audit discussion, and when I put in the manager's discussion and findings, and you'll see how much each of our programs we supplement with the local tax match. It is very interesting to see, like almost all of our programs, we use those local tax dollars. There's no state funding that we don't supplement to some level, and even this one. Other places, they may have no local tax. It is just kind of, when you said that, it is a good use of the funds, but we do, like Dustin, sometimes the team there, oh, we want more, we want, like even the 34,998, that might just help with increases in different things and increases in running, input, like the inflated costs from year to year. It's not like, oh, we've gotten this win.
All right, let's go with Susan.
Yes.
Okay.
Yes.
Me, yes. Mike.
Yes.
Zach. Yes. Okay, moving on to the next thing. We already did the employee satisfaction. No, we did this custom. This is it. Yeah.
I spent a lot of time reading all
All right.
Right.
I thought we were redoing what we already did. No, this is totally different.
Looking at a Likert scale on a graph, you have to like,
This is.
and you gotta get percentages, you gotta remember, okay.
Yeah.
Agree and strongly agree can, you know, yeah.
So last month, as you all remember, we had Employee Appreciation Month.
Yes.
And part of that, I just want to mention that Tia Biggest gave me this cute little card and she wanted me to share it with you. It just said, "Thank you very much for recognizing employee appreciation with our gift. Employees appreciated." And so all the employees, and I think you all know, we give them a $50 gift. The board has authorized a $50 gift, and if they got cash, they would have to pay taxes on it. But if they actually give a tangible gift, they don't have to. So the way we do that is we give them the ability to pick something off Amazon. And so everyone picks something off Amazon. Taylor always gives me a gift. She should start. But I got a wire stripper, which people were thinking a wire stripper, and I'm like, I'm so excited about my self-adjusting wire stripper, but nobody else is. But what do you get, Dustin? But I don't know what Tia got, but she was very thankful. So our employee satisfaction survey results. So this is the same format, so it's kind of boring just because it's the same one we do every year, but we do it so we can compare year to year. A little bit of improvement, but for the most part, pretty stagnant. My supervisor and I have a good working relationship. I know, Dr. Chape, you probably scoured this pretty closely. I think what you may have noticed was you may have noticed some people that may appear disgruntled.
That's understandable in a survey like this.
And disgruntled people they let their voice be known. And as we get to the comments, you'll see that.
But before you go, when I look at this, the thing that I took away from it is you have less disagree than move to. So that's actually an improvement.
Yeah, that was an improvement. And I think there was a few more strongly agrees than in a couple of areas. So.
And I think, when you look at this, so my supervisor and I have a good working relationship. And if you look down at the agree and the strongly agree, so if you add those together, that's 70%.
That's the same.
Roughly, that agree or strongly agree. So over 2/3. So I guess that would be our people, right? I don't know what you guys are doing, but Taylor and my people are doing. Management within my organization recognizes strong job performance.
That jumped.
And again, if you add these up, we're at 71%. Are either in the agree or strongly agree.
That stuff is cool and all, but I find it more interesting that it's the disagree and neutral have actually gone down.
They have gone down.
So those are your disgruntled people that are, even though they may be upset, they're not as upset.
And more shift
But they're
to the
no
right.
longer working.
Or they're gone.
Dan is gone.
I mean, if you just broke it down like this one, if you looked at 25, it's really 64% of the agree and strongly agree, and it went up to 71%. But again, the strongly agree is very high on the red compared to the other previous years. So it's trending the right way.
But even the people that are upset, I think, aren't as upset.
Flop off the bottom 5 and bottom 10%, top 10%, is probably what you're really looking
And and some of this is
at. I mean, Andrew can't fill them all out.
Yeah, is this all rigged?
absolutely
Okay. That's
what Taylor said. Whatever I needed to do to make us look.
that sounds good. All right.
Just
And
like
I think that's actually one of the comments. So
a Russian
that wasn't
presidential
true.
election.
I'm able to make decisions that affect my work. You know, the trends are pretty similar.
You got 82% in 2025 that were agree or strongly agree, down a little bit. But I think if you look statistically, the response, it's still you got good. And
Communication between senior leaders and employees is good in my organization.
improving. We're getting a lot of, the disagrees went down.
So our neutral went up quite a bit.
The strongly agree people they haven't changed their mind. They're excited with whatever. It's the neutral and the agree, those people, and the disagree dropping.
Right.
Those, once again, it's what I was noticing throughout the thing was that you're shifting the people that disgruntled into, I'm still mad, but maybe not as mad.
I'm ambivalent. So your big praise for me is Andrew's moving people to ambivalent.
Well, that's better than being disgruntled, at least.
Jim's like, he's really good at making
And
people
there's
just
some people,
love.
it doesn't matter, you could give them the world and they're still,
I mean, it's,
you don't pay me enough, you don't do that.
I mean, that's just,
Well, and I think
They're not getting polished, but they're done.
Yes.
And I think some of it is, and I think we've had talks about this with our team. We are working on strategies to make sure that we are passing the things down a little more effectively. And I think I'm trying to do a better job to make sure that everyone understands what my expectations are. So we will see what happens. How clear are the goals your supervisor sets for you?
Well, accreditation with this, they've had to do lots of different projects and add this to it, and here they're doing their regular job and they've added this to it. Maybe, I don't know.
An extra layer of complication, extra.
Yes,
thing to do.
yeah, that maybe,
More
because
documents to think that they're already doing.
not that it was high, that much higher, but it just seems there's been a lot of, probably some extra things. So last year.
Lots of new things. Wouldn't you agree, Cindy? We've had so many like things that are different than, probably more things that are different and new than we've
We've
had
changed
in
Pay
years.
schedule,
And
they
you're-
changed the-
You know, Andrew, as you pointed out, you're codifying CQI and organizing it, and then repeating. And once that's organized, you continually improve, that becomes culture.
Right. But I mean, I just look at like the past year, like what we've done.
Yes,
And
that's what I just said.
all the, like, everything
This
has
concept,
changed.
yes.
And I always pick
Hi,
on
board
Michelle
accreditation.
because she is so funny, because she's so honest with, she's like not the biggest change lover. But she really was excited about velocity. And then she's like, that'll teach me forever wanting change. And so I always pick on her.
Maybe. It won't.
I like the fact that you had zero for that, not at all clear. That's pretty interesting.
Yes, that is.
So that means you have some kind of goals, even the people that don't want to hear it still know there's goals. Good.
Just say it louder, they're clear, right? I'm satisfied with the culture of my workplace. You know, again, not the one person with the strongly disagree. That's not too bad.
No, this is good data because this get people who when they're asked specifics, they'll give suggestions, but the big picture, this says you have a good, healthy place to work.
I'm not even sure how Zach was able to fill it out.
Right.
Oh, it's great. It's where it should be.
And our disagrees are actually down from previous years, so.
It does say something.
And I do think overall, those that are positive are more positive. And those that have been negative are about the same amount.
Probably the same people.
The employees all get to see this.
We'll go over it next Wednesday. And I'll make a table. She's like, no, you're good. But Cindy, would you say that our people that are more positive are more positive and those that have stayed negative are about the same? It's the same people. And we have not been able, we can't change.
As long as they're doing good work and they get along with everybody, it is what it is.
And we'll look forward to next year when maybe we see those go to zero. You know, or maybe they'll just go to the disagree. Or you see QI.
So employees treat each other with respect. So
So there's improvement.
That's all skewed towards this.
Yeah.
That's actually.
So we've had improvement there. Because we've had 0 disagree, only 1 strongly disagree. Senior management and employees trust each other.
Ooh, now there's your bed ones.
That's what I'm going for.
But again, as you pointed out, you could make the case that it's gone from the disagree to the neutral.
Yeah.
And so
It is
it's a
improvement.
shift.
It is improvement. Even if it's ambivalence, it's still an improvement.
As long as we're shifting to the right.
Yes.
And I mean, I guess I had not looked at it. But I suppose
That's a good one.
if you are looking at it as you gotta earn my trust. And you're not going to go from I distrust you to I have all the trust in the world. That would actually be what you're going to see. See a shift rather than we distrust you to we strongly agree we trust you. So I guess we just have to see what the trending is like. I'm satisfied with my overall compensation. I think either Kim or Susan said you're never going to make people 100% happy, particularly on like this. Everyone could always use more money, but generally, you know, we've got 71% of people that are, you know, agree or strongly agree. And then you add in 16% that are pretty neutral. So you're at 87% that are.
But I think public pay increases over the past 2 years, this reflects that everybody is cognizant that changes are being made and adjusted.
The strongly disagree and the disagree have dropped.
Yeah, my friend Taylor the other day was pretty vocal about the topic when someone had brought up, you know, oh, the pay, and she's like, there's been clear changes, and I know Cindy and Dustin, who have been here for several years, they've seen change, like people who were saying the Platte County Health Department has made no, because there's some comments in there that there's not change in the compensation packages. They are like, no, we beg to differ.
We're competitive.
I sat
like
through a few
they're
meetings.
Yeah, and if you're comparing here to other health departments, I mean,
We've had 2
Yeah,
rounds.
I have friends in other health departments that like their starting pay for a health educator is higher than people who've been there for 5 years at other health departments.
Yeah.
So I mean, obviously everything has gone up. Gas prices are high, food prices are high, so like Andrew said, like everyone always wants more money. You know, you can always make more money, but
As long as you're pulling your weight and you're contributing, I don't have a problem with it.
But also our pay structure takes into consideration the purchasing power of the dollar and adjusts for the inflationary effects of it. So people don't feel as much pain.
Well, there are board minutes that reflect that we've taken, like, several, probably hours worth of work.
We know we're doing okay. We know we're doing the right
I think
thing.
we have to
I
wait
think
on
we're all
that.
at peace with that. What's
So don't say
good
that
is
again.
to see that the staff, that this is,
Not yet.
there's transparency to the staff.
Have we voted on this?
Yeah.
Oh, I see.
Transparency.
Oh, but that-
So I get excited about going to work. So we've had a shift
Yes,
there.
you know, I mean,
Kim's like, oh,
I don't know. The older I get, the less excited I get about it. So I'm just
like,
being
that's a
transparent.
tall order. But this one kind of upsets me because our strongly disagree and our disagree went down, our neutral went down, and our agree and strongly agree went up.
I was thinking you might want to throw that question out completely.
But they went up. And so they must be just happy to come see you, Taylor. I am pleased with the career advancement opportunities available to me. I don't know what I expect to see. Dustin has to walk me off a cliff because I was moaning to him. And I just feel like, we've done the tuition reimbursement. We have made major changes to the structure to make sure we have built-in opportunities for people to get levels, and not necessarily just succession planning, but opportunities to advance to the next level for more responsibility and, for them to have places, and Dr. Kingsley and I have talked about this, but, maybe your next promotion isn't here, but maybe your next promotion, maybe your supervisor here and that management job or assistant director job is someplace else. We hate to lose you, but you would have never gotten that assistant director job or manager job if you hadn't had the opportunity to be a supervisor here or a manager. And because we have those opportunities, now we have those 10 people up there on that wall. It used to be what, Cindy, like basically 3 management positions. And we have so many more middle management positions. We're sending them to training. We're giving them opportunities to deal with being a supervisor. Keeping many more people up late at night dealing with supervisory problems. Like I was talking to Paige, I'm like, so how are those sleepless nights that you are fretting about dealing with your direct reports tomorrow? Wonder why I did this. But they are making her a better supervisor. They are giving her, and she would never be ready to go from no supervision to supervising 20 people, or responsible for 20. But someday, because she takes these intermediate steps, she might be ready for all these people. And so I do love the environment.
The other thing too is sometimes you do need to leave to realize how good you had it. So hopefully you can come back,
Yeah.
but you don't realize how well you have it until you go to some other place. This place, or maybe you say this place stinks compared to whatever. But you need something to compare it to, right? And you'll never know if you never get a chance to leave. So if you have the opportunity to improve your status of whatever it is your position is, then you go to some other place, you'll learn what they have to show, and then maybe you'll come back with a different position. Who knows? But if you never take the risk and you don't push yourself, you'll never know to begin.
Taylor told me yesterday this was her favorite place.
All the places.
She actually did say it. I don't know if she was lying. But she did say
I
it.
said other than Peace School.
All right, very good.
That's so different.
My organization is dedicated to my professional development. So I'd say this is in kind of pretty up there. %61%, or roughly 2/3. Overall, are you satisfied or dissatisfied with your job?
Those are pretty good numbers.
77%.
But you have 20% that are neutral,
Mhm.
and essentially none.
None.
So that's, again,
Now, to be fair, we're still missing what, 10 employees that didn't do this. So who knows? Maybe they are so disgruntled, they're like, I ain't doing this. Right? So there's that. But I think overall, for the people that did respond, this looks awesome.
And how often were your contributions recognized? You know, the always, we went up quite a bit. So from, and I love this, so from 2024, and it's huge numbers, 1 to 5, but it is a pretty impressive increase from that 1 person in 2024 to 5 people in 26 saying they are always recognized. That's pretty, I mean, I don't know if, and that's these people recognizing good work in our supervisor. Most of the time, so we went down. So that always most of the time, but it is good that we are, at least some people are always getting recognized. Employees in my organization willingly accept change.
Well.
Pretty consistent.
At least one person thinks 0001. And I took the survey. I guarantee I did not write that one.
You were not the one.
I am not that disillusioned. How comfortable do you feel voicing your concerns to your supervisor?
Excellent.
That's pretty darn good, actually.
Yes, that is.
You all are my supervisor. I'm one of these 4. I'm joking. And then you all looked at these. I don't know how I would read all these, but were there any of these that stood out?
PTO.
About the bank.
the trend I
The bank,
saw,
they don't call it PTO, I think.
there were some consistent comments about communication things, and I think the individuals who felt like there was not good communication from leadership down. I was seeing some of that populated in there. I'm more curious about if the leadership team, what they're gonna do with this information and how specifically are they gonna try to handle this comment related? Because I think the trends clearly show improvement. I'm not sure how, I'd be curious to know what the plan, if any, is, comment.
So I'd say,
Or for any of the data from this.
so I know what we have talked about in our, so we are now meeting monthly in our, so we have a managers meeting. Us. And then we have a leadership team meeting with us and the supervisor. So it adds 3 more. And one of the things, 4 more of them. It's like you always forget one person, but it's 4 more of us. And so one of the things that I have talked about doing a better job of, and this is for all of us, is when I meet with this group, is for them to have a similar meeting with each of their teams, having the same agenda in an abbreviated form and going through it with their team and making sure that, because I'm kind of long, but making sure that the things that I'm putting emphasis on for the department, making sure the things I'm wanting to make sure we're doing department-wide is being communicated to all. And that is kind of what the trend was. And so one of the goals for all the managers, supervisors, is make sure they're having those meetings. That's cascading down better. Cindy and her team, they call her out. They do a really good job of only having those meetings and always have. And she actually takes notes. So she just always has. That's been her MO from before I even got here. And she'll share the notes. But that is one thing that we have talked about. Whenever we have managers. So that's one of the things we talked about. We went over this all together. And that was probably the main thing.
This actually is one of the things I was going to talk about. So on the right, it says committee levels. Yeah, we're still working on that, but setting examples. I think that's key when you're talking to, when you're the supervisor and you're talking to people that in your group, is that nothing they do is beneath you. Everything that they can do, you should be able to show that I can do that as well. Everything you do, I value because I myself can do the same thing you do, and I know how important it is. Stuff like that, really, like you said, morale boosts. Showing that every employee has an essential role here. Pay dividends later. Really have to stress that there's no role or task that's beneath anybody. We all can do this. I've done it. You can do it. Boom, boom, boom.
I have a slide I'd be happy to share with you. It's called "It's Not My Job" slide. Have you
Yes,
seen it?
yes.
Not my job. There's some roadkill, middle of the highway, and you're zoomed in on it. You see the paint truck in front of you, and painted right over the roadkill. A striping truck lays paint right over the roadkill. It says, "It's not it's not my job." And I use that with all the staff and use it to point out that when I had the emergency department, I used that, and I used it in a national lecture saying, the top down, you gotta be willing to do everything. Change the sheets, push a patient to the floor. The physicians need to be willing to do that. And again, that kind of a culture it gets built well when everybody remembers that image that, well, it's not my job. Well, wait a minute, it's everybody's job to make sure it gets done.
If I'm in the hospital and I'm walking down and I see somebody drop the tissue paper, it grosses me out, but I still pick it up and throw it away.
That's a Boy Scout.
And I wash my hands. It is, but the point is no role or position or anything that's beneath you. Anything they do, you yourself should be able to do. You need to show. You can talk all you want. You need to show that.
Now, to defend the people here, I will say that I say for the most part, everyone sitting here has exactly that attitude. There is some disconnect in the staff. Like, regardless of how many times they see that exemplified, they just don't do that. Because honestly, there is, and I think everyone's seen it from me, there's nothing in this that they all see me doing. Those are my personal wires, but everything else here, oh my gosh.
And I do think that culture is changing. A lot of people who have that not my job. I mean, there's always gonna be. So that's not my. Andrew's really trying to. Anyone can do any job. Sometimes you have to do the dirty job.
And I'd say that's the other thing, is sometimes you can only get rid of the people who sometimes have that mentality, can be inspired to have that mentality, can be peer pressured into it, and some people just, attrition is the only way to
Yes.
get rid of it. And so that's the stage I'm at.
What is the leave? I'm reading this right here. What about the leave? What do employees earn this? I may have to do. I don't recall.
Cindy,
The full-time employee.
Okay.
so they earn a lot.
What was this person? What do they think?
They're just saying they want it in
Like
one
a
time
bank.
bank, so they can use it for sick or they can use it for,
They make their choice of how they.
which is kind of where hospitals are going.
It kind of, to me, kind of encourages less sick time
Yeah.
because you don't have that in that bank. I guess you could look at it two different ways,
A
but
lot of them get rid of sick time when they start to do. They say there's no sick time. it's
Yeah.
just, like,
leave.
You just have leave. So.
So we have some.
And that you cherish it more than, oh, I've got,
I still cherish.
I
it
have
either way.
24 sick hours and I'm going to use those because if I don't, I'll lose them.
Mhm.
And PTO, you kind of can keep, or you can keep a portion of it.
Yeah, I guess there's different ways to look at it.
And we have some issues with judicious use of
Sick
leave time, period.
Okay.
And I have no idea who made that comment, but I will tell you that we have several people that use all their leave time, whether it be sick or vacation time, as quickly as they.
Yes,
I work with some people like that too.
I earned it, I'm gonna use it. Attitude.
But then there's karma.
Uh-huh.
I'm just saying that I
That's
always say,
correct.
don't use all your sick time
Because you
because
don't
you're gonna
know.
get sick. And you
Gallbladder
won't
stuff.
Well,
Just right up on you.
That's how I look at it. Like, I'm not getting any younger.
And some of the comments that are on here are direct results of that happened,
I see what you're saying. Yeah.
because they have. We are attacking them and being unfair.
Been discussed.
But they know the rules. They play the game. It's up to them.
Yeah, we probably have to. It will become.
All right.
Parental,
Like,
so you don't really,
You use your
we
sick
don't
leave.
have FMLA.
so that's right.
So, but like we are FMLA like, so if someone has a child, we try to mirror it. But like their paid leave, they would get like whatever sick leave and vacation they've accrued, and then they can have their short-term disability.
Yeah.
So they, maybe Cindy could explain it better, but they end up getting
Oh, yeah.
paid for a lot of it.
Yeah, that's the way we had to do it.
Yeah.
Plan.
And basically, you do have to, you know, Taylor has been with us for 2.5 years. And she has a lot of leave. We have people that have been here for 4 years that have 0. So,
Yeah.
It is.
like the communication comments too. I've never before in my life had so many ways to communicate with people. You think about it. We use Teams, we use all these different methods of work, and
Text.
it's still a complaint. Text, email, Teams, the chart, all, you know,
Scheduled meeting.
I don't know, favoritism.
This is what I always. The micromanaging, I'm not sure if people are micromanaging. I will say that is something I'll get accused of. Do I micromanage?
Vicky very, very clear and has like a specific set of things.
Mhm.
But
So I am very demanding about that I want a product that is excellent. And I will not ever accept a subpar product, but I do not micromanage. And so I will be very specific about it needs to, like with our TV up front, I wanted it to look exactly right. I needed it to be a certain way, but I never hovered. I never said you have to order it from this place. I gave the overall specs and I said, I want it to look like this. I was very specific and picky about what it looked like. Sometimes micromanaging is confused with being picky and a perfectionist. That I am guilty of.
Well, this one survey's anonymous. Anonymous,
I think one thing too is in order to get higher salary increases, you're going to have to start doing more independent things, projects, whatever. That will alleviate hopefully that, where you can actually show that I could do this myself. You don't have to look over my shoulders. I can accomplish this task. So hopefully that will minimize that a little bit. Give the people the chance to show off their skill set that they have.
Oh, and we have been trying to do that too. And then, I mean, when people need help, it's not like I want you to read. So it's a coaching and it is a learning experience too. I mean, Taylor has worked with me for many years at this point. I'm sure there were points where she wanted to throw rocks.
Not since she got her therapist budget. She's good.
The other thing too, though, is you have to give people, so you have expectations, but you also have the expectations that there is going to be a little bit of failure. You're not going to succeed at everything you accomplish. And so people have to put that into bake that into the cake, right? And so as long as you tell them that, I don't expect you to be perfect all the time. You're going to make mistakes, but you should learn from your mistakes. That's the key. Don't repeat the mistakes.
Don't expect perfect all the time.
But getting back to what Kim was saying, so they want more communication, but then they want fewer meetings. They want increased interaction, but fewer meetings. Obviously, there's a different people, but it is kind of interesting.
Well, you know, we've got the education budget. There's somebody saying, unless I seek higher education, I feel there's a level of mobility, and why not?
And so, like, Cindy has some so one of the people that used to work here, she wanted to be an environmental. It is pretty clear at the state level that to be an environmental public health specialist, you have to have a bachelor's degree and you have to have 30 hours of science. You can't substitute experience. That you have to have the science background. And she was like, well, I can go inspect. And she could do the mechanics of an inspection. But I could do the mechanics of open heart surgery, maybe.
ER usations all the time.
But I have no idea what I'm doing when it comes to open heart surgery. Like, you need me to know, like, actually what's going on. Just because I can do the mechanics of it, that's not good enough. And so it's kind of like that, and that's what we tried to explain to her. So, like, there are positions where we need you to have the science background to know what's happening with the microbiology of food safety. Now, there might be another position, say for a clerk or the clerk manager, or maybe if you are a clerk and then you move to clerk supervisor and that requires a degree, maybe that would be okay to have 14 years of clerk experience and be very good. Maybe you could use that experience to substitute for the college degree. But you're going to have to be excellent. You're going to have to always be there. You're going to have to be super, like, you would never be one of the people that have an attendance issue. You're going to be the person that's always reliable, always doing more than everybody else. You're going to be that trusted person, right, Cindy? You're going to be that person that we can't operate the building without. Those are the types of people we would be promoting, like for a degree needing position without the degree where we could do that. And sometimes people don't understand. Like they don't want to pay their due. They don't want to. I don't know how to explain it, but they're like, I should have Andrew's job. Well, I actually had to do some stuff to get my job.
To jump through hoops.
And have lots of years of experience and get some education and do some stuff. We could all get $1 million.
That would be.
Work here long enough, you'll get it.
Start investing early.
Okay, so this person. I don't know how you would do that, but.
I think you kind of explain that when you have your team meetings and following through, and they give you the communication level.
I think this would have been enough for them to put out thoughts and concerns and ideas. For the survey,
Yeah.
just.
No more yelling at employees, please.
Sorry, I wrote that one. I took that browser.
I can't imagine anyone yelling.
Oh, I can't.
Some people.
Probably me at Taylor.
Oh, okay. I guess they're how they perceive it. I guess.
Is that it?
Oh, we have. Yes.
Oh, I meant,
Chelsea.
was that it for the survey?
Yeah.
Any questions about the?
I think you should do it once a year. I know that one person said you should do it multiple times,
Ooh,
but I think
no,
once a
it's
year
not necessary. No.
you'll be able to get a better idea of how much you're improving or you're not improving. Or staying the same.
And you're taking that to the staff
Wednesday.
Wednesday. I mean, if there's a couple of things on there like they wanted some ideas, kind of like what Zach was saying. It may be, are there any, any ideas that someone has on this particular thing? Maybe let them throw out a couple of ideas. That's what we used to have to do when I was a manager. You have to bring back get the information and discuss it and then get
If you have a
feedback, make a chart, with the feedback, what are we in agreement that we will,
So it would be interesting. Because we'll have all our people. And if I did that,
it may last for.
no, it would be critical.
Oh,
I guarantee there might be maybe one person that might say something.
Out of 40 people.
Because we saw this when we did our strategic planning, like, all right, here's your time to talk and like share your thoughts and things. And
And it wouldn't be the person that would have written it.
So
It would be someone like Taylor and Justin and Cheyenne that would say something.
are they shy or are they just they want to get ridiculed? Or in their mind, they think it's something.
So we have, and I hate to say it, and this is ultimately one of Cindy's. Sometimes we have people that aren't actually looking.
oh, okay.
Sometimes they just want to take the problem and make the complaint, but they aren't actively trying to solve issues.
Their attitude is, well, you're the manager, you fix the problem.
Or they just want,
I think sometimes we talk about it too, is like, more often than not, it's just gossip because they're complaining to one of their peers. They're not actually bringing this to their supervisor or someone to actually change and do anything about it. I know there is with HVAC, like one day, like, oh, it's really hot, get back in the nurse station. I'm like, no one said a single thing to me. I had no idea about it. So we just quick little fix, easy.
so my definition of office gossip basically is talking about anything that anyone who can't do something about it. So if you're talking to Dr. Chaffee about the humidity, he has no power to do anything about it. That's office gossip. And I have no tolerance for it. I have like fear about all this humidity. Just sitting there with your coffee cup. All these millions of dollars they're spending on the HVAC units, and it's just more and more problems, just wasting all that money.
That's how we all feel.
Like you're talking to him and nothing, like he can't do anything about it. And I walk by during that conversation and you're quiet every time I walk by, when really I could do something about it. And a couple of years ago, we had no hot water in the clinic for months. No one told me. Everyone complained about it. No one told me. That's office gossip. I have no room for it. We need to tell people who can do something about it. Once I was told about it, 3 days. I mean, I had to get someone here,
Right.
but 3 days, it was like $800 instead of months of. And I hadn't noticed because I don't go back there to wash my hands. I had hot water. I was happy. But anyway,
And now we've created a better system for that, maintain that system that people, and if there's a,
And then it's reported.
yeah, we can add due dates and to it.
which
That's
prompted
one of the
that.
systems.
Which prompted that. Because it was really frustrating.
All right, do the personnel thing.
Chelsea?
Just the one. Right, so.
Make a motion to approve hiring paperwork signature needed for personnel action. Chelsea Lipa. For being hired as full-time health educator one, effective July 20th, 2026. Chelsea was set, starting at scale step 13-1A at $29.11 an hour.
Have a second?
I'll second that.
Second.
Okay.
Further discussion, Susan?
Yes.
Yes.
Me, yes.
Michael, yes.
Zach?
Yes.
Okay. Now, do we gotta go to executive session or no?
Next meeting is.
Oh, yeah. So the next meeting will be, when is it? It will be August 20th, 2026, 6 PM at the Platte County Health Department. All right, do we have a motion to end the meeting?
I move we adjourn the meeting.
Do we have a second?
Second.
Okay, Susan?
Yes.
Ken?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
All right, thank you, everybody.
Thank you.
Okay, so we need to sign